Why do you become refractory to a drug?
Why do you become refractory to a drug? It's a multifaceted answer, I guess. Number one could be that the leukemia cells. I'll possibly bring an analogy to the bacterial world. And when we treat infections, particularly if you have exposure to an antibiotic for an extended period of time, the bacteria become resistant to infections. And many times the bacteria, they try to figure out how to avoid the drug. It may be just, pumping the drug out of the cell. Sometimes the leukemia cell does that it pumps the drug out of the cell. Or if the drug is targeting a vital survival pathway of the leukemia cell, say they are dependent on a particular mutation, right? And now your drug is targeting a particular mutation. Now the leukemia cell kind of rewire the system to an extent that they will find another way to survive, not be dependent on this mutation alone. So that's another mechanism, right? And sometimes this ends up acquiring newer mutations. A very common situation that we see in this space of FLT3 mutation, which is one of the bad mutations in AML. But there are drugs available. There are drugs like midostaurin available, gilteritinib available, and there are other drugs which are in the pipeline too. But for a patient who is exposed to this FLT3 inhibitor for an extended period of time, sometimes acquire additional mutations, and they become resistant. So the cell figures out a way to rewire itself or change its dependency.
Thanks for watching. By creating a HealthTree account, you can get exclusive access to the latest HealthTree University content, track your course progress, take notes, and bookmark lessons. Visit the links in the description below to get started.